TU domain, what is TR domain. Okay, so TU and TR domains are, these are specifically there for oncology studies. Okay, so solid tumors or any tumors. So in the oncology, so we prepared this TU and TR domain. So other therapeutic area you won't see any these two domains in anywhere. Okay, so what is this? For example, uh, you are recruiting the cancer related subjects or patient in your study. So how can we identify whether the subject having the tumors or not? We are doing some one type of cancer, so whether that type of cancer is there to the subject or not by using like MRI, CT scan, X-rays. So these are the procedures generally we use to identify whether the subject having the tumor or solid tumors or any other tumors, what is our requirement. So those tumors are present in the body or not, we are checking by using this these methods, right? So this is nothing but identification of the tumors. So we are using TU domain to capture, to identify the tumors. Okay, so here there are two types of generally tumors. One is targeted lesions, another one is non-targeted lesions. Lesions nothing but abnormal changes in one organ or in a tissue due to injury or disease. Okay, so these lesions targeted and non-targeted. So targeted lesions are nothing but which are measurable. So those we can call it as target lesions, and which are not measurable. So those are non-targeted lesions. Okay. So here two types are there. So targeted lesions, the specific, the tumor, the cancer tumor length of diameter should be greater than 10 mm and max of 5, max 2 per organ. So each and organ in the body. So this is a criteria for the targeted lesion which we need to evaluate, which is measurable. So that measurements are like this. It should be greater than 10 mm and max of 5 target lesions we need to take. So max of 2. So 2 tissue solid tumors per organ we need to take. And whenever you are taking the 5 of max, should be shortest lymph node should be greater than 15 mm. So the length should be measurable. In case of non-targeted lesion, so it should be present or absent we need to get. So non-targeted lesions we are not measuring. Okay, so here you can see the TU domain. So each and every targeted tumor, so we are giving the numbering like T01, T02, T03. So if it is a non-targeted lesion, okay, non-targeted lesion, we are giving the NT1, NT0, NT02, 03, like that we have to identify and giving the number a variable called TU link ID. Okay, so if it is a targeted, non-targeted, two types of lesions are there. Non-targeted lesions we are giving the numbering like, so NT1 like this. Targeted the lesions we are giving T1, T2, T3 like that. Okay, so here you can see the methods. Okay, CT scan or clinical evaluation, and TU location nothing but where the tumor location is. So which organ or which place the tumor was identified. So the tumor location was captured in the variable called TU location, and which method the tumor was identified, whether CT scan or clinical evaluation or any other procedure we are using to identify. So TU domain nothing but identification of the tumor. Okay, so here these are the things in there in the TU domain. So first one, whether it is a targeted lesion or not targeted. So whether the numbering we have to give, and the TURRs places, whether it is a targeted, non-targeted, and which method we are using, and location we have to include it in the TU domain. So next, coming to the responses, that is called measurement. So we need to measure that one, right? So the measure related information you can find in the TR domain. Okay, tumor response related domain. So here also you can see in this which one is the targeted, non-targeted there in the TU domain, right? That related. So same TR link ID. So there is a TU link ID, right? So same TR link ID, same tumor, whether it is a targeted or non-targeted. targeted, we get two types of parameters. One is longest diameter, one is sum of the longest diameter. Each and every targeted tumor, so we are measuring, that measurement was captured in the TRORRES variable. Here you can see, so first subject, for example T01, that is 5 millimeter. Okay, so second T02, so that is a 12 millimeter. Like that, you have to measure each and every targeted domain. So sum nothing but, so all this sum you can put into the sum of the longest diameter. Okay, we need to sum of all the this 12 plus 12 plus 5, so you will get a 29. Like that, you will measure the targeted lesion. So what about the non-targeted lesions? Non-targeted lesions, simply you can mention the response like whether it is a present or not available or absent, like that. Okay, so here two types of lesions are there. Targeted domains, targeted lesions are present in the TU domains, are measurable. That measurement was happening two parameter. One is longest diameter, one is the sum of longest diameter. So longest diameter, so we will measure and we will place that value in the TRORRES, and the units are TRORRESU, nothing but units. So in case of non-targeted lesions, so we simply mention it is a present or absent. Okay, present or not available or unable to evaluate or absent, like that responses you may expect. So no need to measure, or we are not measuring non-targeted lesions. Okay, so once so we get this information, so whether what type of response it is given by using our drug, so that was captured in the RS domain, that is response domain. So three domains, TU, TR, RS is the interlinked domain. Okay, RS domain, it will show whether which type of response it is giving. Okay, for example here 1007 subject, non-targeted lesion, so it will give progressive disease. Progressive disease nothing but, instead of decreasing, the tumor size is going to increase. Okay, so the targeted lesion, stable disease nothing but, so it should not increase or should not decrease while using our drug. Okay, so we have a complete response, partial response, and stable disease is there. So we can get the response from here. So based upon their measurement, so the raw data set, they have given the responses. That response variable we need to map here. Okay, so this is the response. So these are the interlinked. So whoever go with the 2 plus, no need to worry about this efficacy related SDTM. Who are going with 3 plus or 4 plus, so just mention the TU-TR domain. These are the domains generally handled by the senior programmer. So if you want, so this information is much enough about the TU domain. So they will ask you if you are not working on, so they simply ask what do you know about the TU, TR and RS domain.